So recently we updated the article we published a couple of years ago about telehealth or telemedicine. And what we found is that the results over the last 2 years are not as rosy as what they were when we originally wrote the article. There's still a push to get telemedicine or telehealth access and utilization up in rural areas, primarily because what's happening in rural areas, if you're not engaged or tied into those systems, is that hospitals are packing up and they're leaving. So telemedicine in those areas could be a benefit for those customers or patients. Also, in the mental health arena, telemedicine could be, or telepsychology and psychiatry could be of great benefit, as people could call up their provider and utilize those services over the telephone or Skype or some type of system where they're face to face or over the telephone with a care provider. The hangups that have been observed is that, number one, people want to go see a doctor. Most people are still captured in the historical way of dealing with the medical community, and so that's a major hangup. There's been billions of dollars invested in different companies who have brought forth ideas that they thought would be innovative to help bring this service to the masses, and it's just not adopting. The problem is that people, number one, are just not aware that the service is even available, or that there's even a capability or a possibility to utilize such a service. So the education hasn't been there. There's been a lot of creativity and funds generated and companies developed, but the trickle down to the actual customer just hasn't happened. So that's what's happening. If you want to finish reading the article and give some feedback, we'd certainly like to hear it. And that's what's happening in telemedicine as of 2018.